are some of the common minority health issues. My name is Dr. Steele. I am a holistic doctor in family practice. I hold 6 degrees in my field. They're all in the natural healthcare space, and I went to school, so you don't have to. So, minorities experience higher rates of chronic disease, mental health disorders, and infectious disease than non-minorities. These issues are often related to social determinants of health, such as poverty, education, and certain environmental factors. By addressing these social determinants of health and promoting health equity, we can improve the health outcomes of everyone. Minorities experience higher rates of several issues, and some of which are not seen, like medical gaslighting, transgenerational traumas that have been passed down through the DNA, complex trauma. And these health issues are often related to years and years of oppression, as well as systemic racism. Chronic diseases such as diabetes, hypertension, heart disease are more prevalent among minorities. So for instance, African Americans and Hispanics are more likely to have diabetes and hypertension than non-Hispanic whites. Additionally, minorities have higher rates of obesity, which can increase the risk of chronic diseases. From a holistic perspective, is it because of the environment, or is it because of holding on to so much trauma? Mental health disorders are also more prevalent among minorities. For instance, African Americans and Hispanics are more likely to experience depression and anxiety than non-Hispanic whites. Additionally, minorities are less likely to receive adequate treatment for those mental health disorders and often are shamed and blamed in our society. That can lead to worsening health outcomes and definitely not wanting to take care of oneself. Minorities are more likely to experience infectious diseases such as TB, HIV, AIDS, and this often is related to limited healthcare access and, of course, those social determinants again, so poverty, lack of education, acting out of trauma, all kinds of things. To address these issues, initiatives such as increasing access to healthcare services and preventative care, as well as addressing those social determinants like poverty and lack of education, can really, and also to promoting diversity, can really get to some of these root causes of health issues, which can, of course, promote health equity and improve health outcomes for everyone. I think one of the things that is really not heard or understood is trauma gets passed down in one's DNA. And so just because I was born free, my parents were born free, etc., doesn't necessarily mean that trauma hasn't been impacted. I know for myself, my grandmother was schizophrenic, my great-grandmother had depressive episodes, but she also had alcoholism, lots of substance abuse in my family. Even on my father's side, even though Irish English background, that Irish side really carried a lot. And also on my dad's side, there's Native American ancestry as well. So again, mental health, addiction, etc. It really pummeled both sides of my family, which in turn impacted me as well. And so it wasn't until I really decided to make that change and make that shift in my own bloodline is when I really got very fascinated with the role of ancestral trauma and how that's passed down in the DNA, because I didn't want to just be a statistic. And I think a lot more people within our generation and our cohort are really looking to stop the trauma from passing down, but we still have a lot of work to do. So it's not just, oh, it's all in our head, or you just need to suck it up. Those are those kind of old monikers that have been told to us really to shame us for having emotions and having impact. We can't heal unless we acknowledge what has happened. So acknowledgement is a part of it, taking our own personal responsibility, and then really getting to work in terms of what needs to happen for us to be able to move forward in and of ourselves individually, as communities, and then as families and people as a whole. So I think we're in this weird kind of transition where there's one group that says, oh, none of these things exist. Systemic racism doesn't have any kind of healthcare impact. And then there's another group, which is a larger group I'm thankful for, that's really beginning to understand, wait a second, if generation after generation is impacted by, let's say, things like slavery and genocide and poverty and famines and all kinds of things, that is going to carry in a DNA. There's a lot of research out there in regards to transgenerational trauma and the impact that it has on our DNA. I'm currently in a PhD program really studying applied psychophysiology and studying the role of trauma and how that affects us. So again, it starts on the DNA level, and then it bleeds into our lifestyle as we are being raised. So if we're not taught to eat healthy or take care of ourselves or love ourselves or practice good self-care, then that's going to lead to us not practicing self-care, not having healthy boundaries, getting into poor relationships. The ACE score, which is the adverse childhood experiences, studies really showed that people that had more adverse childhood experiences early on were social determinants towards chronic disease later on down the road, meaning that they developed chronic disease later on down the road as a result. So there is a correlation between how these things impact us on the DNA level and then in turn affect us in our lifestyle, our upbringing, then teaches us how we take care of ourselves. And then as we are not taking care of ourselves, not eating right, not drinking enough water, et cetera, then our health begins to break down as our organ function begins to be impacted, and then our chronic disease rates go up. So hopefully that really helped to summarize some of the minority health issues. Please, I love this topic so much. Unfortunately, we have to talk about these things. I'm grateful to be able to talk about these things. The unfortunate part is that they exist. The fortunate part is that we can have these open dialogues. So feel free to comment below. I'd love to share more, especially about some of the cool studies that are coming out to really bring this topic to light.